This is the third episode of TruDoc podcast series, and we have today the great Dr. Kanaan Al Kanaani. He is the champion of the integrated health project with Johns Hopkins Aramco Hospital, which is a project involving two components. One is the hospital at home, and one is the telehealth.
Right.
And I think we had a lot of fun integrating both of them. And thank you so much for your time today. Would love to hear a little bit about this 2-year journey now.
It's
been almost 2 years.
Yeah. Well, thank you for the introduction. That's very flattering. The telehealth project in Johns Hopkins basically encompasses two arms, two services. The one is the telehealth, which is the tele-consultation, which is labeled as after an hour. And then, the virtual ward, which is now branded as hospital at home. And both services come for a need in our organization, Johns Hopkins Aramco Healthcare, to basically close a lot of gaps and create those kind of opportunity to improve our operating models. So, for example, for the telehealth, it covers a big gap of, a lot of patient needs and healthcare needs of a specific kind of level, which basically the children, the people who have minor illnesses, and possibly they don't have to travel to the hospital building and wait for queue and busy urgent cares or emergency. So that close that gap and short circuit, the distance.
Yeah.
And actually, patient loves it. It is really convenient, and of course, when we partner with providers like you guys, we find that quality is maintained, and we see it through our own journey so far. The hospital at home comes in really as a solution to debulk the business in hospitals, and across the kingdom, we have a lot of bed constraints for many reasons. And health system works in a very complex way, and the needs sometimes cannot be matched with supply, especially when we have sick patient or population with multiple comorbidities. So we don't want them to spend a lot of days in the hospital setting where they can be taken care of at their home, near to their beloved one. They're happy to do the recovery in a familiar environment, where again we have very elite service such as the hospital at home, which is stand out by its technology enabled solutions like the telemonitoring, and having a team of multidisciplinary people coming and visit the patients and interact with them, provide all necessary things away from the hospital building. And a lot of countries who applied this model basically embarked on this model of care, not only to create capacity as the hospital and just to decrease the risk of infection and decrease the mental illnesses because of long hospitalization and all that stuff. The proof for that at the end, we have happy patients. So, and I think
that is the end goal.
Yes, yeah,
always.
So, yeah. Not to mention how the literature now growing the evidence of the positive health impact and outcome of both models.
Yeah.
The safety of it, and how much this create the cost effectiveness in multiple health systems.
Got it.
Yeah.
And Dr. Kanaan, I think the entry point to this and the start of our work together was mainly the telemedicine part of things, and
Right.
there are different camps around the world, or maybe those camps are now at disappearing as telehealth is becoming more and more hygiene.
Right.
But there are still people today who say that COVID-19 as a pandemic came, it created some sort of a hype around telemedicine.
Right.
And then people tried it, some people loved it, some people will not use it again. So from your perspective as a clinician, how did you feel the impact of the pandemic on telehealth? And from your perspective, is telemedicine here to stay or to go?
Right. See, we cannot ignore the fact that the pandemic played a major role in shedding the light on such a model of care, right? So the technology comes in as enabler into this. So there's no doubt that a lot of corporates were created and built and, to develop just telehealth during COVID. Now, whether they sustain their business and survive after that or not, I mean, it depends on what you are offering and how viable your services to, match the demand and needs and maintain the quality and what have you. So we're living an era now, and we're the best testament that such model exists because the need is there, right? It just, when you want to deliver the service, you just make the patient in the middle, understand the finance and the resources needed, and just make sure that you have all those workflows and the mechanics around how to make the service reach to the patient. And also getting the patient involved in such modality. It's a new modality. People tend to have the classical picture of having the doctor comes to visit at home. We see this in movie, and the tele-consultation have some examples in our life where, for example, the doctor called the patient for a result or asked them to come to see, but not in the shape and form of what we do now, where we have a discipline to the service, where we manage it, measure it, and then govern it. So definitely it stays, but for organic reasons, but definitely the nature of how multiple enterprises embarked in the model, developed it, and add value to it. I think it's gonna stay. Again, technology gonna be always an enabler. It's not the goal.
It's not the goal.
And I think the future carries an exciting things for us, as healthcare workers to start with, to explore leverage for the benefit of our patients.
And I think it's not going to be only the future, but the present as well. As you and I were discussing a moment ago, that the world has already moved on.
Yeah,
it's already here. Technology is already here. The change in care models are already here. We're seeing a lot of these care models applied differently for different conditions, different health populations, and different healthcare systems as well. And you touched on a little bit on the value and cost effectiveness of some of these approaches. So whether it's the hospital at home or telemedicine or an integrated care model that either in a primary care setting or in secondary care setting can help as a cost-effective measure, because as we always say, healthcare costs are inflating for individuals, for families, for governments, for private sector. Everyone is struggling with this today. Right? So how do you see those interventions and those programs maybe playing a role in alleviating some of this burden, achieving patient happiness, which is the center of everything that we're doing, but also tackling some of the healthcare system issues?
So all this boils down to the fact that health services become now commodities, right? And they carry a cost out, and the cost inflate because the way we deliver those services from the health practitioner at the front end of the patient, and how organizations practice medicine, how they finance it, and how they profile it and provision it to the patient or to the users. And not to forget the health costs become part of the economy cycle. It's a service, it's a commodity, it's a product that we sell every day. And if you bring this to how sustainable health systems, definitely the cost comes sometimes even the first before looking at the quality. This is a reality. We need to accept it. We have to accept it, because the sustainability of healthcare system has to come with resources, and resources means money, means people, and
it has an impact on individuals, right? When insurance premiums are increasing and are inflating, it's having an impact on families and on each individual on its own.
So it's as a commodity. If we want to call it that, you tend to have different level of sophistication, different privileges, and the last thing you want to have in any country or any health system that have people come short of being able to receive medical treatment. So cost element in delivering the health services is very important, and it's the governments, the people in leadership in any organization, and it boils down to the frontline provider and how they work, in more cost-effective way, which basically do things in a more lean way and more efficient, being more of evidence-based, and try to inject values of what they do, and be careful about overdoing things sometimes, because it might cause harm at the bank statement and also at the patient, which comes first. So when the digitalization comes, it for sure injects that cost effectiveness element to it. An organization has to be very careful from considering the digitalization as a tool or as a goal or as a process. And I think we have that discussion earlier about when a lot of people, think about digitalizing healthcare, they think this is the goal.
Yes.
And I think, there is a paradigm shift now that this is a process. This is a way of getting the goals that we all strive for: happy patient, good outcome, and financial viability. Definitely, a growing evidence show from our experience, from our, collaborative work together, that definitely we're providing a more cost-effective model through a remote, service like telehealth, whether it's in the hospital, at home, or at the telehealth. And the cost effectiveness comes from, short-circuiting all those unnecessary steps when patient comes physically to the hospital. And also we're short-circuiting those things that keep the patient in the hospital setting, which is an expensive kind of, setting. And then we can resource them, repurpose them at a more of simple, comfortable environment at home. And by doing that, we eliminate unnecessarily things that come just because of the environment in the hospital dictated, because of all the practices, the way we do this, and hospital policies and clinic policies that sometimes dictate and mandate that the provider should do things every day the same they are doing it, without having a second thought of how can we make this of quality and then more cost effective. So I think in terms of digitalization in medicine, it has to account for the cost. It has to inject that cost, and people who lead such services, decide upon them and strategize them, need to think about the cost. It's definitely as equal, as important to the patient outcome. Maybe it comes second, but sometimes in reality it comes first.
It's all connected, right?
And
so
they are all connected. Yes. So there are eyes in one head,
100%.
The two eyes in one head.
100%.
So yeah, that's reality, and I think people wanna have a sustainable system, sustainable business, need to think this way. It worked before, it's working now with us, and it's very, very, very useful indeed. And I believe people who had a long way in health industry, and they are sustainable and they become major competitor, they manage their finance very well in healthcare.
And I couldn't agree more. The technology is the enabling the environment, and I do agree that as you mentioned and as you taught me today, that digitalizing healthcare is a process. It's not
a goal.
It's a process that is happening today, and it's inevitable.
Right.
Everybody will have to go through that process, whether now or later, and the decision is on them, on whether on whether to be able to be part of the innovation now, or decide to be left out of it. So, thank you so much for your time. Thank you for everything that we have achieved together. I'm only looking forward for more, and for living the present and planning the future.
Thank you so much.
Thank you, Dr. Kanaan.
So thank you, Dr. Tarek. I think this is a lifetime experience. And what I learned in a nutshell is, medicine and medical services is not a transactional activities. It is services that should have a commitment from the provider, commitment from corporate that handle it. It's people life, people's health, and getting people's happiness is very, very difficult. But I can tell you, and we are both healthcare professionals, it's the rewarding thing for us. And that's what keeps us, every day, working and thriving, to provide the best. So in all our daily work, let's call for a motion of for all care provider, whether they do face-to-face or do it through a digitalized portals. It is not a transactional. Let's keep our bread and butter live, and the evidence-based practices and the good best practices that we provide to the patient. And I think all what we have discussed, it will come with. So let's not forget that. And this is a message for all healthcare provider and the young one coming up with the digitalized era.
Yeah.
We still, healthcare worker. Let's think about the patient, put it in the middle, and the best practices should prevail. Thank you so much, and I enjoyed this, and we should do it more frequently.
Absolutely.
In always positive notes and good milestones. So,
absolutely, 100%. Thank you so much. Thank you so much.
Thank you.
Thank you, everyone. Stay well, and we'll see you in future episodes.